One day after President Obama apologized for problems with the federal health care website and for problems millions of families are having losing their health care plans, House Speaker John Boehner says he's skeptical the Obama administration can take action on its own to keep more people from losing their plans. The Republican says the president will need to work with Congress to make that happen. The president in Louisiana and Florida today telling people he's working to ensure they can keep their current plans and that everything possible is being done to get the healthcare.gov website to work.
We're working overtime to make sure that it gets fixed because right now we've put in place a system, a marketplace where people can get affordable health care plans. You know, I promise you, nobody's been more frustrated. I wanted to go in and fix it myself, but I don't write codes.
Always investigating 7 News reporter Russell Haythorne asking what's next for those who have lost their current health plans despite the president's pledge. Russell?
Teresa, what we're finding is there's no good answer in terms of what's next. Among the thousands of Coloradans who are losing their health care plans as a result of the Affordable Care Act, there's still just as much confusion and frustration as ever. Janet Chappell is infuriated by the keep it if you like it political catchphrase.
It's a lie. It's a blatant lie.
She works for a small property management company.
The small business plan that my employer offers is being canceled by Kaiser. It's not an issue of cost, it's just they are no longer going to be offering small business coverage.
Kaiser and Anthem insure about 75% of the people in Colorado with now canceled plans. Vince Plymel with the State Division of Insurance says the cancellations affect less than 5% of Coloradans.
There were a lot of plans out there that were bare bones with limited benefits that didn't really offer protection to people in terms of their benefits and didn't protect them from, say, serious financial ruin.
Not true, says Chappell.
This is not what I consider a bare bones plan by any means.
She spent time researching it and says her plan exceeds the minimum coverage requirements of Obamacare.
We have office visits that are free, we have prescription coverage, we have mammograms, colonoscopies.
Right now, Chappell pays nothing out of pocket. Her boss picks up the tab for coverage that includes her husband, and her son and daughter in their 20s. New plans with the same deductible will cost her about $1,100 a month out of pocket.
That's just for my husband and myself. It's not the family coverage that we have now.
In Chappell's case, there's a double whammy here because her husband also works for a small flooring company, and his small business plan is being canceled as well, so they couldn't fall back on that even if they wanted to. And Chappell says she's finding that the state exchanges actually have higher rates and deductibles than most of the individual plans she's researched on her own. Live in Denver, Russell Haythorne, 7 News.